So I have to ask the question, dialysis is one of those services. Are we still working on trying to get dialysis services closer to home here?
Yeah, so absolutely, and I think Wendy, it's one, when I arrived here, I had no idea that dialysis wasn't actually provided by Quinte Health. And I can't say that I wasn't deeply disappointed when I got here. However, it is offered through one of our partner hospitals, which is Kingston. And Kingston works with the Ontario Renal Network to plan for expansion. So we have been advocating. Recently we got a local clinic that's been expanded, which I think is going to help. But we have to advocate and continue to advocate to work through that opportunity. And we would like to include that as part of our clinical service planning, even though we're not responsible and we can't actually approve it. We would like to include that. If our community says that's the most important thing and we can collect data, it's just another source for us to actually work together in terms of advocating.
I think that's very important for the community to know that it's not dead in the water and that it's something that's still being worked on. You know, every year the foundation has to raise money to fund medical equipment that the government doesn't fund. So this year you've asked us for $1.8 million in new and replacement equipment. Why is it so important for the community to help us and invest in this equipment for our staff and for our patients?
So many people don't know that government does not pay for equipment. And so if you want your community to have the best care possible, we have to give our teams and clinicians the best equipment possible. And equipment changes. You know, you think about if you were using the same phone, from 1990, you probably wouldn't even know how to flip it open or find the buttons. It's the same. Equipment changes, and the difference. So when you think about a phone changing, maybe it makes your life easier. In fact, maybe it doesn't make our life easier because we're spending too much time on them. But for equipment, it actually saves lives, right? Yeah. So if you can have a new mammogram that actually can detect things that weren't possible even 5 years ago, it changes the individual lives. So that's why it's so important. Similar, healthcare and medicine is just changing so quickly. You need to be able to do that. Other ones, another great example is something as simple as beds. For the seniors in our community, if you don't have a good bed, we have the potential of actually having their skin deteriorate, for them to have pressure ulcers. So we need to replace our beds. We have a lot of people come through. So there's tons of practical examples of
and
either.
People don't realize either. A bed could be $8,000, upwardly $42,000 for a bariatric patient, right?
It's
like the mammogram, $650,000.
Yes, and
we have to raise.
I'm so excited to be coming to Boob Bash later this month to help raise. The public should know. I personally donate to
so do I.
Trenton Memorial Hospital.
That's right.
And am right behind all the not the volunteer efforts, but the fundraising efforts. And every dollar counts. And I know we have everything from kids to older adults to philanthropists in our community. The other area, and Wendy and I have talked about it, of the other potential, it's just not equipment, but how do we support our teams here? How do we help them to get education? I know you have bursary and funds. We not only have to give the best equipment, but we actually have to make this a really fabulous place to work and support people in the development of their skills. So there are really important opportunities to make local healthcare better by supporting and fundraising for your hospital.
So investing in the foundation is an investment in your healthcare and that of your community.
Well, especially the Trenton Memorial Hospital Foundation, and I'm not going to talk about locally, but let's say provincially.
That's right.
You are fantastic, right?
Thank
you guys are really progressive. You're really responsible. You're ethical. So I can't think of a better place.
We love what we do.
Yeah, I can't think of a better place for people to invest their dollars, and because you're going to get a great return. You're actually, for every dollar you put in, you're going to have a stronger hospital, and you're going to have a better team, and you're going to have better equipment.
That's right. Stacey, thank you so much for being with us today.
You're welcome.
It's been a pleasure, and we really look forward to working with you even more.
Me too.
Thanks.